So conventional treatment is really kind of focused just on treating with chemotherapy and radiotherapy. Nutrition is not really considered. Most of my experience is that patients always mention that nutrition is never touched in any of their consultations. And I should say it's a very important part, not because it's my area specifically, but going by clinical studies, there's a lot of information where patients are not diagnosed adequately by nutrition status, and they go into this traditional treatment, and the level of toxicity rises incredibly by the 4th treatment, right? When they're programmed to go 8 or 10 treatments. And they actually have more secondary effects just because of not having the adequate nourishment or having the adequate nutritional evaluation to understand where the patient is. I think this area is actually very critical because we have to understand always that the tissue does matter, how much lean body mass and how much fat mass the patient has. Example, in the studies that I mentioned, most patients that had major toxicity had major amounts of percentage body fat versus lesser lean body mass. And this is a standard evaluation that you do for nutrition, right? Understanding where your patient is and where you can take your patient to, right? So I think that's a critical part of oncology, of nutrition for oncology, I would say, to always understand where your patient is before they go into treatment.